call the meeting to order and rise for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all for coming tonight. This is a very, very important meeting, and I really appreciate your attendance and participation. So we are now going to do the roll call.
Director Wallace.
Present.
Director Nicholson.
Present.
Director Stewart.
Present.
Director Danielson.
Present.
Director Ethan.
Present.
Are any oral communications tonight? Okay. Written? Any written? None of those? Okay, we are going to, before we move to the action item, Nancy, would you like to provide some background?
Yep, I'm quite pleased to. With this board's authorization, we propose to the County Board of Supervisors an organization to help oversee the rescue of St. Rose. And we chose the Joint Powers Authority as a vehicle to do that for a number of reasons. This was presented to the Board of Supervisors in February, and most recently, last Tuesday, the Board of Supervisors met after a period of consideration and took up that matter. And after a fairly in-depth discussion of the issues surrounding St. Rose and the need to keep that hospital open, they took a vote. And we received 5 votes aye for the JPA. This matter now returns to our Board of Directors for consideration and discussion this evening. Perhaps because we want to move things along as rapidly as possible, because it's been a long time now that St. Rose has asked for help, and we have a need to get it to them as quickly as possible. We began discussions with St. Rose Council and their chairman of the board this afternoon around the idea that there could be an interim management agreement under which we can begin to help St. Rose while we craft the larger definitive agreement. And Paul and Kimberly attended that meeting and I believe made very good progress. I think one of the major concerns of the chairman of the board of St. Rose is the issue of clashing cultures. And I think that's a very sensible concern when you look at other hospitals that have joined the same system. There have been problems with that. I think the one thing that unifies Washington and St. Rose is the patient-first ethic. They may not call it that there, but I believe that organization is motivated by those very same principles that we hold dear here. One of the things I think that would really help is, I'm going to be away next week, but in the following week and in subsequent weeks, I think it would be a good idea to have employee forums at St. Rose for them to get a chance to meet me and kick the tires, understand a little bit more about Washington, and for me to learn a little bit more about them. And I want them to meet the executive team over here, and understand a little bit more about a district. They know a lot about being a private nonprofit and very little about being a district. And we know a lot about being a district and very little about being a private nonprofit, and those differences are real. But I think they want to be reassured that we aren't going to interrupt their mission. And I want to be able to face them directly and tell them that's not why we're there. We support their mission, and that's the whole reason for Washington stepping forward to make sure that they'll still be there and not become a proprietary hospital operated by a Prem Reddy or somebody like that. That we support the idea of a nonprofit community hospital taking care of its own community. But I think they needed to hear this from the leadership of Washington and have a chance to ask questions. So I think that's an important step. I think if we're careful and thoughtful about how we present ourselves at St. Rose, that we can bridge those cultural issues. I don't expect them to become just like Washington, and I don't expect people at Washington to become just like them either. And they're two separate institutions with separate licenses, separate medical staffs, separate boards. But we'll all be brought together under this joint powers agreement. And I was very pleased when we were supported by all 5 of the supervisors. So tonight, I think it's important for the board to discuss the JPA, which lies before you. We've invited our legal counsel here, so he's available if there's a need for any questions, and discuss the need for doing this.
Okay, I think in order to get the conversation going, I think we ought to start off with the action, and then we can have the discussion once the action is put on the table. So at this point, Dr. Epen, would you please present the motion before us?
Mr. President, I move for adoption of resolution number 1117, authorizing the execution of the St. Rose Transition Authority Joint Powers Authority Agreement.
Second.
Thank you. Before we do any kind of voting on this, this is a complex arrangement involving our district and the St. Rose Hospital, which many of our district residents know about. Many of them were born in St. Rose Hospital, and St. Rose has provided great care for thousands and possibly hundreds of thousands of people over its 50 years of existence, and it's a loved and cherished asset of the community. It serves many Washington Township residents, many of which are low income and really not capable of affording the kind of health care that many of us are blessed with. Because of the complexity we have and the uniqueness in some respects of what we are trying to do to assure the continuance of St. Rose and the attendant benefits to the South County and to the residents of Washington District also. We have the good fortune of having Paul Kozachenko, who's the board attorney, work diligently with council to create an agreement which will govern, at least at the outset, the relationship that we have with the county. So I think it's a good thing at this point in time if Mr. Kozachenko would read resolution number 1117 so our district residents can understand it. Thank you.
Thank you, Mr. Wallace. Resolution number 1117. Whereas Washington Township Healthcare District is a local healthcare district which owns and operates a general acute care hospital and provides essential healthcare services to the population residing within the district's political boundaries, including the cities of Fremont, Newark, Union City, parts of South Hayward, and Sunol. And whereas St. Rose Hospital is an independent, not-for-profit community safety net hospital with an emergency room located in Hayward, Alameda County, California. In addition to operating St. Rose Hospital, St. Rose owns and operates related entities. St. Rose provides general acute care and other necessary medical services to the residents of Alameda County, particularly to traditionally underserved populations. St. Rose is an integral part of Alameda County's healthcare delivery system. And whereas St. Rose recently notified the county of Alameda, the district, and other local governmental entities and stakeholders that it is having severe financial problems and faces the prospect of being unable to continue operations. And whereas approximately 15% of the district's residents receive healthcare services from St. Rose Hospital, and whereas approximately 5% of the children who receive health care at St. Rose's Silva Clinic are district residents. And whereas the Board of Directors of the district believes that if St. Rose were to close, a large portion of the population served by St. Rose, including non-township residents, would seek health care from the district, overwhelming the district's emergency room and leading to a shortage of hospital beds. And whereas in light of the above and the serious consequences to the district, should St. Rose close, on February 22nd, 2012, the board authorized the chief executive officer to sign a letter of intent which outlined a plan to work with the county to save St. Rose. The LOI provided that to save St. Rose, the district and the county would form a joint powers authority under state law. And whereas the county and the chief executive officer of the district have agreed to the terms of the joint powers of authority, the joint powers authority will establish the St. Rose Transition Authority, which will advance the objectives of the district described above. A copy of the agreement is attached hereto as Exhibit A. And whereas the County Board of Supervisors approved the agreement at its regular meeting on April 17, 2012, by unanimous vote of the supervisors. And whereas the board has duly considered the potential crisis facing the district if St. Rose were to close, and has determined that it is in the best interest of the district to authorize the chief executive officer to sign the agreement and deliver it to the county. Now therefore be it resolved. The chief executive officer is authorized to sign the agreement and deliver it to the county, and the chief executive officer is authorized and directed to take any and all further actions necessary, which in the determination of the chief executive officer incorporate the substantive intent of this resolution, and to perform any and all other actions contemplated by this resolution.
Thank you, Mr. Kozachenko. I think it's important for board members to express their opinions, concerns, comments as to why it is important that the Washington Hospital Healthcare District take this action that we're contemplating tonight. So with that said, would any board member like to provide some background or information they may have about the potential JPA?
I'd be glad to start that off, Mr. Wallace. In my 10 years on the board of directors at Washington Hospital, I don't believe we've ever contemplated a more serious matter than what we're up against right now. Nancy Farber has characterized it as a health and safety crisis for the county. It's my hope that after tonight, we will have been able to inform the district residents of the seriousness of this situation. The decision we're contemplating tonight is, I believe, extremely courageous on the part of Washington Hospital. At the same time, it's extremely challenging. We're up against a very, very challenging situation. However, all of the other alternatives for St. Rose are not good. And St. Rose has an emergency room that is extremely busy. It's also a possibility that the San Leandro emergency room will close. That would leave only one emergency room in South County, other than Eden Hospital. It would be very, very difficult for us to continue operations with our emergency room flooded by patients. This is a serious enough situation that not only has Washington Hospital stepped up to the plate to look for alternatives, but Kaiser Permanente and the Alameda County Alliance and Cal Mortgage have all expressed desires to work on this. I'm happy to want to support this. I believe it's a very, very necessary thing to do. I see it as a moral imperative And I see it as something that I can be proud of Washington Hospital for stepping up and wanting to do this. I'm also fearful of what we face. It will be we do a pretty good job of running one hospital. To take on two and help and support another hospital will be an extreme challenge. I'm grateful to our administrative staff, Nancy Farber and all of the other people that work with her to step forward and make this move. I'm anxious to support it. I believe that we must support St. Rose. And in the end, it will be a great help to all the district residents, all the people in our district and the people in Hayward that go to St. Rose. So I'm happy tonight to lend my voice to this most difficult challenge, but I still see it as a moral imperative that we do it.
Thank you, Dr. Stewart. Dr. Nicholson?
Yes, Bernie, I agree with you on almost every one of your points. I think this is clearly an imperative for our district, and it's an imperative for the community. I think the formation of the Joint Powers Authority is one of the best examples of government. Government has, in recent years, not gotten a very good rap. But I think this has demonstrated the best efforts of the public sector. We've got two entities. One is the Alameda County, and the other is the Washington Township Healthcare District coming together to form an entity to allow an essential public service to remain. St. Rose is quite critical, not only to our community here within the district, but the community with which it serves, and there's considerable overlap between the two. St. Rose is a well-established hospital. It's been in place for over 50 years, and it's not a small hospital. It offers many services. There's a large number of our physicians on our staff which also go to St. Rose, so there's considerable overlap there. The other thing is there are very many services that St. Rose must provide to its community. And if those services were not available via St. Rose, that would disadvantage the patients within that community, and it would put tremendous stress upon the services that this hospital could provide to our community as well as other surrounding hospitals. I'll just tick off a few examples of the services that St. Rose offers. It offers a family birthing center. It offers an occupational health clinic. It offers basic orthopedic services for injuries. It offers both inpatient and outpatient surgery, physical therapy, rehabilitation. You can see all of these are important to taking care of the population at hand. It offers basic cancer care services, including radiation therapy, so that the patients being in that community do not have to travel far when they're seriously ill. It has the Silva Pediatric Clinic, which is serving the very young population there, which needs to get started off right. And it also has a women's center, including comprehensive obstetrics and gynecology services. So you can see that St. Rose is not small. It's well established. It has a large number of physicians, not quite as many as we have here at Washington, but there's a very strong physician community there. And the physician community, I know, supports this Joint Powers Authority. Also, St. Rose is an area of significant financial activity for the city of Hayward, and thus provides not only to the physical and emotional health of the population, but also to the financial health of the surrounding community. So that's an important thing we have to recognize. So I think that the formation of this Joint Powers Authority will give Washington Hospital and the county the opportunity to put St. Rose on a better footing, on a footing where it can continue to serve its community and continue its most important mission, which is providing those essential healthcare services to its community. And I would agree with you, Bernie, that this is a moral imperative, not just Washington trying to protect itself, but really a moral imperative to allow the continuation of these services in the St. Rose community.
Well, thank you, Dr. Nicholson. Ms. Danielson,
Thank you.
please feel free to make your comments.
Thank you very much, Mike. I agree with Dr. Stewart. This is probably one of the most important decisions that I have been able to be a part of since I've been on this board. And I think it's probably one of the most important decisions that this hospital board will make. In my past career, I have worked for other nonprofit hospitals. And the thought of a hospital closing it cuts right through me. I cannot conceptualize it. I cannot see a community having that terrific resource being taken away from them. I can't fathom it. I've done an awful lot of thinking. People have come up to me and spoken to me about it, and it has made me feel very good that they are very encouraged. They feel that what we are doing is the right thing, and they're very, very thankful. I know that the people who are now currently being served by St. Rose they're on tender hooks, hoping that this will all come together. I feel too that this district hospital was created by people. Hospitals are people, and it was created for the people in this district. And tonight's action is really all about people. We're talking about the very young, the pediatrics, the brand new babies, the seniors, the adults, everybody from birth to death. And to close down a hospital is just, it's tragic. We have to do something. We have to be optimistic because we cannot allow this to happen. The people, I know the people within that St. Rose serves, they love their hospital. It's a part of them. And I'm hopeful that we will be able to help them out. I also see it as we're like a family. And when one member in the family is in need of help, the other members need to come to their assistance. So I think that Washington Hospital is a part of that bigger family and is coming to help one of its members in doing what needs to be done. I'm very, very hopeful that this will work. I'm very optimistic about our staff, and I know that the staff at St. Rose will be able to work with us, and I'm just very, very optimistic that it's going to work out. I feel that what we are going to do tonight, hopefully what we're going to do, is the right thing to do. Financially, it's a very sound decision. But I'm also listening to my heart, and my heart says it's the right thing to do. Thank you.
Thank you, Director Danielson. Director Eaton.
Yeah, I think I pretty much agree with all my other board members who have spoken right now. I've always been taught to love your neighbor, and I don't think there's a better example whereby you're helping a neighbor, and especially a neighbor that has got a prefix of saint attached to the name St. Rose, I think you'll be doubly blessed. Having said that, I work in the southern part of the county. I work for the county clinics, and although the numbers state that about 15% of our residents, our district residents, use St. Rose, I think some of my patients, I think about 20, my numbers would be about 25% of them, the children who go to St. Rose. And like the CEO Nancy Faber had said, this would have been a public health crisis if the hospital had closed its doors, and it would have sent the whole thing into a tailspin. And I think in the last 10 years, we have had about 61 emergency rooms that have been closed in this state. The only reason that I would think is they probably didn't have another Washington hospital district close by to rescue them. And I'm really glad that we are making this decision tonight. And the other most important thing that where I'm concerned is the disproportionate population that lives in Hayward. The numbers pretty much says that about 17% do not have any insurance, which is about 20,000 people, I would think, from a population of 150,000. And about 100,000 patients were seen in the outpatient last year, about 35,000 patients who were admitted in the hospital, employees, about 1,000 employees, 350 staff, MDs. I'm sure all of them would be really grateful, I think, to the leadership of this hospital, people who have come up with an innovative idea to form a joint powers of authority and to rescue the hospital. So I think the credit should definitely be given to the leadership. Within 2 months after we decided to send a letter of intent for this to happen, I think the whole team should be given, the whole leadership team should be given full credit for it. So I'm pretty much with the team, and I think it is, a great thing to do. And at this time, I was actually, when the old President John F. Kennedy was visiting Canada, one of his quotes was, geography has made us neighbors, history has made us friends, economics had made us partners, and necessity has made us allies. And I think necessity is the mother of all inventions. In difficult situation, to come out with innovation, and being very ingenious, and to do this, I think it's a great. I think it speaks volumes.
Well, thank you, thank you, Dr. Ethan. I have always been impressed by the love of the community residents and the quality of the staff at St. Rose, and the dedication of its board of directors, of many fine people that I know personally that are on the board of directors of St. Rose. And they have an excellent record and a tremendous foundation, which just demonstrates year after year the love that the community has for that facility. So the sad problem that we're dealing with is really not a failure of the hospital staff or the community. It's really more a failure of the system that we all find ourselves stuck with at this particular point in time, and so many poor people that go to a facility with great care, and the facility gets very meager revenues from the various governmental sources that are charged with the responsibility to reimburse that facility for the care that they distribute, which is excellent care. And that's a sad thing. And so we could put our head in the sand and ignore it But that, I think, has been expressed by my fellow board members, would be the wrong thing to do. The emergency room at St. Rose sees 35,000 individuals a year, and not too far from the number that we see. I think ours is 50, 44.
Around 50.
Around 50. 84% of those folks are either Medicare, or they just simply do not have any insurance. And I can tell you from being a businessman for 40 years, it's very tough to make up losses with volume when you have no margin. And so I think we're blessed to be able to provide the kind of support that we're talking about tonight, because we have an excellent management staff and an excellent medical staff and tremendous employees. And we have the opportunity now to do something that's right. And aside from the rightness and the moral prerogatives that we're employing, it's a very good use, I think, in the long run, of the scarce assets that will be available to all of us over the course of the next 5 or 10 years as healthcare unfolds. Because we all know how expensive technology is, and how expensive management is, and how expensive the different processes that we provide are. And the opportunity to spread that cost over a larger base of individuals and patients, and to me provides an opportunity to further, not only further enhance our capabilities of the services that we provide, but create better, more efficient operations across a greater volume of individuals. And it's been said many times that we live in an earthquake area, and there's supposedly going to be a significant earthquake in the next 30 years. I heard that 5 years ago, so it's probably next 25 years, I don't know. And we all know when earthquakes have occurred in different areas of our state, one of the first casualties of those quakes are the highway ramps and off ramps and on ramps. And the reality of this situation is we have a major healthcare facility on the west side of 880. Of course, we are a major facility, but as Dr. Nicholson has said, this is a major facility. It has 217 beds and 350 physicians on its staff and 1,000 employees, and services that are quite complex and across the board. So it's important that in a calamity that we have major healthcare facilities that can serve both the east and the west side of 880. So that's another potential blessing that we will have by being able to pitch in and continue to assure that St. Rose survives and thrives, just not survives, but thrives in service to its residents and also to ours. Presently, 13% of St. Rose's emergency room visits in recent past, or 4,400 visits, have come from Washington Township district residents. They end up there, and they get great care. So it's not anything that's new. And so collaboration with St. Rose across a larger volume of patients, I think, is going to be good for both communities. So I'm entirely in support of this effort, and I want to thank Nancy and your team for bringing this to fruition, and the County Board of Supervisors for their understanding and agreement to participate as well.
When we were at the supervisors meeting last Tuesday, I learned something I didn't know, and that was over the last 6 or 7 years, the county has provided St. Rose with $40 million in support and assistance. And I think that in all of this, as we move ahead trying to provide a future for St. Rose, that we have to remember the county has played a key role in keeping this institution alive over the last decade. And that's not an inconsequential number.
No.
And they have done it without obligation. They have recognized the importance of St. Rose too, just like this board has. And I think back to why the district was formed, Washington Township, and the district residents wanted access to health care. And anything that would threaten that access for our district residents is of enormous concern to the leadership. We have 50,000 visits a year in the emergency room. We're a cardiac receiving center. We're a stroke receiving center. We have plans to become a comprehensive stroke center. We are operating out of an emergency room that is woefully inadequate for the size of our mission. It was built in 1965 when the district population was much smaller. Should St. Rose close, and we know now that Eden has been unsuccessful in its lawsuit against Sutter, and that San Leandro Memorial now is likely to close, our district residents' primary objective in supporting a district would be massively interfered with because we don't have the ability to absorb that kind of emergency room volume. We're nearly at capacity now. We're biding our time till we can get our new emergency room and critical care unit building built, the Morris Hyman Pavilion. But that's a ways away yet. We haven't even bid that project. In fact, that project is still at Oshpot. So when people want to know why we're doing this, it's because we're protecting our ability to provide to the district residents the whole purpose of the district, which is access to medical care. It's not a game of who's paying for care and who isn't. It's straight numbers. Hospitals don't exist in isolation from one another. And with the future of San Leandro so dim at this point, which makes me very sad, the idea that we could lose St. Rose as well is beyond tragic.
Let me interrupt you for a minute, because I think many viewers may not understand the significance of the Cobra and Tala law.
Yeah.
And the fact that there's no discretion in
Yes.
terms of
Exactly.
who and when people get where they come from, or when they're treated and they show up at our emergency room doors. So maybe you should.
The federal law is exactly that. You can't turn anyone away from an emergency room, and nor should you. And you may not screen people financially until they have been stabilized. And that was done because there were some notoriously corrupt proprietary hospitals in Texas that were turning patients away. And they were migrant farm workers, and they didn't have the means to pay their bills, and they didn't stabilize them. They just basically sent them away, and these people, in one infamous case, a migrant worker died crossing the lawn to go to his car while his family watched. And he had not been cared for in that hospital, so the feds passed a law. And with them, it's, one size fits all. They don't distinguish between hospitals that have done no such thing like that and the ones that did. So there's no ability to control the emergency room volume. If these two hospitals closed, we'd be drowning.
And what would be the consequence if the real significant downside, beside the enormous wait times that our district residents would face if we were flooded with the residents from Hayward?
The only way to slow down the flow is to ask the county EMS services for bypass, which means that the ambulance services wouldn't be bringing people to your emergency room until you could stabilize the number of patients that you have there and not overload the emergency room. But if you ask for bypass because you're overloaded, you're not allowed to have any elective surgeries go forward, and you're not allowed to have elective procedures in the cath lab go forward. Those things are held in abeyance. So that's where our bottom line comes from.
Yeah, like it or not, those procedures
Pay the bills.
pretty much pay the bills for the,
Yeah.
for the emergency room services.
So if you ask for bypass because your emergency room's overloaded, you can't do those things. And it's a very real economic threat to the hospital if there was no way to take care of that volume but come here. Wouldn't be long before this hospital would be in the same straits as St. Rose and have to close. So when I say that hospitals don't operate in isolation from one another, this is a good example of that. And it doesn't have anything to do with payer mix. It has to do with numbers of patients.
Numbers, volume.
Sheer volume could bring us to our knees, and we wouldn't be able to do the things that make a margin for us so that we can carry out our mission. And I know that when people compare Washington to St. Rose, they see that Washington is a much more affluent hospital. But you can very quickly lose that margin if you can't do the things that make it. And I think there are some economies of scale that we can bring for both hospitals. You don't have to have two of everything.
Right.
And I know that IT systems are horribly expensive, but as we've gone through the process of purchasing Epic, it is possible to extend Epic to St. Rose once it's fully implemented here. We can run them off of our own system.
For those that don't know, I think you ought to explain what Epic is. For
Epic is an online medical record, and there is tremendous pressure coming from the federal government for all hospitals to develop them. It is a medical record system that exists at Kaiser, at Sutter, at UC. They're in the process of installing it just as we are right now. Stanford has it. It's at UCLA. It's basically become the lingua franca in California for electronic medical records. When we first started talking about putting this system in, it was pre-Accountable Care Act. And I thought it was all about quality and evidence-based medicine and improving things, and it still is. But given what's happening with the Accountable Care Act, it's also about defending your revenue stream. And it is going to take meticulous data to do that. And the hospitals that don't have robust systems like Epic won't fare as well. And right now, I think that St. Rose could plan to benefit from that several years hence. And that's another example of you don't have to have two of everything.
Right.
We can do it together. You don't have to have two community relations departments.
Right.
You know, there are a
We
lot
got a
of
brand new
things.
laundry.
Yeah, we got a brand new laundry. That's right. But there are a lot of things we can do together. The other thing I wanted to point out is that a hospital isn't just a hospital. It is a locus of economic activity. For a hospital like St. Rose in a city like Hayward to close would be something that would affect all manner of economic activity. Look around Washington Hospital, look at all the small businesses that are here. There are uniform shops. There are 500 physician offices. They buy supplies. Lots of things are here because we're here, like all the nursing homes, the staffing agencies. But you go down through the telephone book and you can point to a huge locus of economic activity that exists because a hospital is in a community. So losing St. Rose would hurt not only the people that depend on St. Rose for their medical care, it would also hurt the city of Hayward in a very significant economic way. So for any number of reasons, it's important to do this. But when I think about it, I think about the mission that we've committed to, which is to provide access to medical care for the residents of our district. And this poses a huge threat.
Okay, are there any other comments from our board members? All right, then, we are going to proceed to vote. Did we have a motion in a second? Yes, we did. All
We
right.
did have the motion.
We did, okay. All right, so then we will vote. All those in favor? Aye.
Aye.
Opposed? None? We like to do a roll call vote. Let's do that. Okay, so, please.
Director Wallace,
Aye.
Director Nicholson,
Aye.
Director Stewart,
Aye.
Director Danielson,
Aye.
Director Epen.
Aye.
Thank you, thank you. Director Epen, the next motion, please.
Mr. President, I move for the appointment of the Joint Powers Authority board members as recommended by the Chief Executive Officer.
Would like to bring forward the names of 5 people that we recommend serve on the JPA board. The JPA board will have 9 members. 5 will come from Washington Hospital. 2 will be appointed by the county, and I believe Alex Briscoe is one of those 2. The Eden Township Board has been invited to appoint a member of this board, as has the St. Rose Hospital. And the names that I would like to offer for the board's consideration are Dr. Albert Brooks, Neil Marks, Dr. Bernard Stewart, Gloria Furness, and Nancy Farber.
Okay, thank you. So we have the motion, we have the names from our side of things. We're only acting on the 5 that you mentioned. So can I have a second?
Second.
All right. Is there any discussion or comments that anyone would like to make? Sounds like a fine group of
Good choice.
individuals. So with that being said, let's vote. All those in favor? Aye.
Aye.
Opposed? I think probably ought to do a roll call with this too, so.
Director Wallace,
Aye.
Director Nicholson,
Aye.
Director Stewart,
Aye.
Director Danielson,
Aye.
Director Epen.
Aye.
Okay, well, thank you. Any other items for the public meeting? Do we have a closed
No,
session?
we don't.
Oh, well, thank goodness. So we have no closed session, so this meeting is adjourned. Thank you all for coming.